We're living in an era where having a sustainable digital health infrastructure is no longer a luxury. It's a necessity for all healthcare practices. But even with this being the case, so many practices find themselves struggling to keep up with the times. You have some that are selling to larger networks to take the load off of their hands, while others are closing their doors altogether. Now, the good news is you don't have to do either if you don't want to. You too can build the digital infrastructure you need not only to survive, but to thrive. So, today I'm going to walk you through the first step in modernizing your practice, and that is creating your digital health transformation strategy. Now, if you stay to the end, I have a resource that would definitely help you through the process. So, be sure to watch the entire video. Before we dive in, I'd like to introduce myself. My name is Mojisola. I'm a digital health strategist, and I'm here to help you understand and navigate all things digital health and technology. Now, if you're curious about my background or just want to connect, feel free to check out my LinkedIn in the description below. Now, let's get back to it. While going with the flow may work for other places in your life, it's definitely not the approach you want to take when it comes to building a digital infrastructure for your healthcare practice. And also implementing the latest solutions based off of buzzwords or the fear of missing out can actually do more harm than good. The first step you need to take is to create a digital strategy that works for your financial margins, your patients, your staff, and your overall operations. And I'm going to walk you through how to do just that. Now, this may seem like a no brainer or even unnecessary to some, but taking the time to create a digital transformation strategy can not only help you visualize the time and resources needed to actualize your goals, but also save you money in the process. Research has shown us that organizations who invest in proven project management practices, like creating a digital strategy, waste 28 times less money due to more strategic alignment and better performance. Now, this means instead of them spending $28 for a resource, they are spending $1. And this is a major savings for any business. So let's start with something that may sound a bit obvious, but is absolutely critical. And that is understanding your objectives. What are you trying to achieve? Not having a clear objective can lead to wasted time, wasted resources, and ultimately frustration. And that's exactly what we want to avoid in this process. So you might ask, what do my objectives look like? Well, maybe you want to free up some time in your day from administrative tasks. And this could mean automating certain processes. Or perhaps you want to improve engagement for your staff, patients, and external partners. And that could mean interoperability between various systems. Maybe you just want to streamline your payment processing, and that focuses specifically on revenue cycle management. Or perhaps your goal is to attract more patients overall, and that can involve a combination of everything I just mentioned. Now, once you've clearly identified your objectives, the next step is to assess your current status. That's taking a closer look at what your existing patient, provider, and payment journeys look like. Now, I understand that not everyone understands how to put the journey together, and the traditional journey is key. So if you're unsure about how to start that, I have a video that breaks down how to do that here. Now, the next step you need to do is identify the gaps and areas for improvement, understanding where are the tension points in your operations. And if you already have a digital strategy or are using digital solutions like an EHR or a digital front door, look for where error is consistently occurring. I do want you to remember that just because something isn't working perfectly doesn't mean it's not a good solution for you. You may just need some tweaks in your system or better integrations or just more training for your staff. Now, when it comes to staff, I do want you to know that having patient and staff feedback are invaluable resources for understanding your current status. So, if you're not already gathering that type of feedback, Make sure to do that before fully diving into the next part of your digital strategy. Now, understanding your practice from the perspective of all stakeholders is vital, so please don't skip this step. Now, another crucial aspect of assessing your current status is not only understanding who your patients are, but who are their care team? What does their care team look like? Now, oftentimes we create solutions with the patient in mind, but forget about all the other people involved in their care. For example, if you run a pediatric practice, it's important to make your clinic enjoyable for kids, yes, but don't forget about their busy parents. What solutions do they need to help their child succeed at your practice? And this could be as simple as working with a call center to launch reminder calls. Now, if you've identified your objectives and assessed your current status, it's time to figure out what solutions your practice needs to reach its goals. And I want you to remember that solutions don't always mean adding new technologies everywhere. Sometimes the answer can be as simple as the reminder calls that I just mentioned. Your solutions can be as simple or as complex as your budget and needs allow. Now, finally, let's talk about choosing vendors. With your goals identified and your current status assessed and your gaps identified, now you're in a strong position to have a productive call with a potential vendor. You'll know exactly what you need, which will save you both time and money. Now, I believe choosing your vendor is a part of your digital strategy because it's the point where you're going through the interview process, for lack of better words, with vendors. Choosing your vendors within your digital strategy allows you to get a better understanding of the variety that is available to you and lets you hone in on what questions to ask, not only about the solution, but also about implementation and the training stakeholders would need in using said solutions. Over the next couple of weeks, I'll be diving into the different vendor solutions that are out there, the questions to ask, and the potential impact that they can have on your practice. And of course, all this information is readily available on search engines if you have the time to search. So there you have it. You've created your digital strategy to improve your practice's operations and engagement for the coming year. I know this can seem a bit overwhelming, but you can do this. And if you need extra help, remember you can always hire a healthcare strategist like me to guide you through the process. Now, for those of you who stay to the end and want to connect with or learn from other practices embarking on their digital strategy, I'll be hosting a free webinar on October 27th at 5 p.m. Eastern Standard Time. We'll walk through the steps of embarking on your digital strategy in detail and answer any questions you may have in the process. If this sounds good to you, I look forward to continuing the conversation and the journey with you. Feel free to look for the link below, and I'll see you next